Hello everyone, my name is Taylor Rosser, and today I'll be presenting on Chapter 10 out of Peden's book, which is Long-Term Care. In Mackley's book earlier on in the semester, we read on different generations, including Generation Z, Generation Y or Millennials, Generation X, and the Baby Boomers. Today we'll talk about how generations will affect long-term care facilities and the types of generational differences seen in each patient while examining different long-term care facilities. First, I'm going to talk a little bit about the different types of long-term care facilities. A nursing facility can be defined as a facility licensed by the state as a nursing home where the majority of patients are regarded as permanent residents for long-term nursing care. This includes nursing homes and long-term care facilities. There are also skilled nursing facilities, which can be defined as a facility licensed by the state as a skilled nursing facility and certified either wholly or in part as a Medicare Part A, skilled nursing facility provider. This includes skilled nursing facilities or skilled nursing units. Both skilled nursing facilities and nursing facilities provide rehabilitative services where either a registered nurse or a licensed practical nurse is on active duty at all times. A nursing facility receives reimbursement under the Medicaid program, whereas a skilled nursing facility receives reimbursement under the Medicare program. Now we're going to talk a little bit about the types of caregivers in these facilities and the types of residents you'll encounter. Types of caregivers include physicians, nurse practitioners, physician's assistants, registered nurses, and licensed practical nurses. Types of residents, also known as patients, however in long-term care facilities they are referred to as residents because of the length of stay. First, we have permanent residents receiving non-skilled care. These patients are in need of general oversight and supervision in performing activities of daily living, including bathing, eating, and dressing. These residents require more than those in residential, boarding, or assisted living environments, either because of their cognitive impairment or physical incapacity. Next, we have permanent residents receiving special care. Special care units are often a distinct service, such as catering to those with Alzheimer's, who benefit from a physical environment that is quiet. So a special care unit caters specifically to the patient and their condition, such as an Alzheimer's unit at a long-term care facility. Physical separation of a special care unit provides residents the opportunity to move throughout the area without fear of wandering off and fear for their safety. Next, we have permanent residents receiving skilled care. These include patients who need tube fed, long-term ventilator care, complex wound care. These patients typically have reached a plateau in rehabilitative care, and discharging isn't such an option, and they have dependency on staff for mobility, toileting, bathing, eating, and all activities of daily living. Permanent residents receiving skilled care are those 24-hour, round-the-clock patients who will always need a skilled staff on hand, unlike permanent residents receiving non-skilled care. Then we have short-term patients, which are patients who stay in long-term care facilities fewer than 100 days. They have care in distinct units that consists of skilled care for treatment of a specific condition, and often placement is temporary because the goal is the treatment of rehabilitation and then to ultimately discharge the patient. Next, we have respite care, which I like to call elderly nannies. It's a short stay for the purpose of giving the primary caregiver of frail elderly people who cannot live in an independent environment. That sums up our types of residents, and now we're going to talk a little bit about how those residents differ based on their age and the generation they are in. This plays a huge role in long-term healthcare because when a patient arrives, we, as a caregiver or a provider, you tend to not know much about them other than what's written on their medical chart. Having a good grasp of generational differences helps providers give better care in terms of the moods, the settings, the personalities of each generation. Overall, a better understanding helps providers have a better quality of care. So we'll start with Generation Z, which is the generation I'm in. Those are patients born in 1996 and later. Personally, we still rely pretty heavily on parent interaction, considering our age is young. Decisions are generally made by parents. However, the beginning of Generation Z, such as myself, who's 21, your 20-year-olds, your 19-year-olds, and your 18-year-olds who are considered adults, we're starting to phase out and make our own decisions as we are reaching that age to do so. You generally don't see Generation Z in long-term healthcare facilities unless it's rehabilitative, which their parents, either Generation Y or X, are there to assist them in decision making. You generally don't see Generation Z in long-term care for chronic health conditions. Usually it is something that happens, such as a freak accident, automotive accidents, ATV accidents, brain trauma from those. But next we'll talk about Generation Y, which are your millennials. These are patients born from 1977 to 1995. So when it comes to millennials, providers need to remember that a strong connection is key in engaging with the patient. Because millennial patients are so inclined to use technology to engage with their health and prefer it to facilitate patient-provider communication, healthcare professionals will need to become familiar with these trends and immerse themselves in these technologies. Millennials in long-term healthcare will be open and willing to try new things. However, they tend to Google questions that go unanswered, which cause a barrier in patient-provider communication. Next, we'll talk about Generation X, which happen to be the patients born in 1965 all the way to 1976. Generation X are most often the chief health decision makers in their family. They are also relatively demanding, and I think that's just because of their age and their knowledge. They are very straightforward and to the point. When providing long-term care to Generation X, it is important to understand they are very independent, unlike Generation Z. My generation tends to rely heavily on other people for answers, for guidance, and so forth, whereas Generation X really kind of figures it out on their own. So say you have a patient that comes in for long-term care that's a Generation Z. They might need a little more help. They might be a little more opening to facilitating help. However, Generation X might be very closed off at first, not wanting that much help, just because they have grown up as such an independent generation. Next, we'll talk about the baby boomers, which baby boomers are patients born from 1964 and before, all the way up until 1946. Baby boomers mostly want healthcare that's relational rather than transactional. They also expect to communicate with medical professionals face-to-face, and they expect technological solutions to many of their healthcare needs. The baby boomers are willing to ask questions and seek guidance in relation to their healthcare. However, they are also less likely to try new products and services, unlike millennials. Millennials tend to rely heavily on technology, which they love the internet, so they're willing to look up new types of care, new types of products and services, whereas baby boomers have many years under their belt and they kind of stick with the mainstream, what they've known and what they've grown up around. That is all I have for you guys today. Understanding how to take care of different generations in long-term healthcare facilities is a very, very important skill that I think many providers look past. A lot of providers are really good at communicating in terms of patients as a whole. However, knowing how to cater to different generations in long-term care facilities such as your nursing facility and your skilled nursing facility, can be a huge asset. Thank you.